Did you set the meeting up?
Hello, everyone. Hope we're all in. This is Renee Vaughn, and I am sitting in for Chair Ebony Ross. So I want to welcome everyone.
I'm working on figuring out our quorum, Madam Chair. Give me one moment.
Colin, is it helpful for those of us that are actually HSAC members to put HSAC in our names again, just to make tabulating easier and so the chair knows who's observing and who's actually members?
You can, I have the list pulled up. I'm just looking at the participants that are here and just sort of going down and marking.
That is a helpful suggestion, Russell.
Mhm.
Couple of years as secretary, you pick up on at least one or two.
Oh, yeah. Hope everybody's enjoying the sunshine while we can. Well, Colin, we do need to wait on you because I believe after the approval of minutes, you will have the floor. So,
All right. Yeah, give me one second. I'm just trying to go through this as quickly as I can. I believe we are at quorum, Madam Chair.
Okay. Um, we are called to order. Um, is there any public comment?
I did not have any show up that I'm aware of.
Okay. Now we can approve the minutes for August 14th. Everyone has had an opportunity to read those. Were there any corrections noted?
I will apologize for getting them out so late. I thought they had gone out earlier this week, and due to staff being out, that didn't happen. So I apologize for getting them sent out an hour ago. We can punt on those if folks need more time. Apologies, Madam Chair.
No problem. Do we need more time or are we ready to approve them? Anyone need additional time?
Madam Chair,
Hearing none. Oh, I'm sorry.
I have not had a chance to read the minutes, so I will not vote as a result. So if anybody else would like to move forward, that's fine, but I would like to wait.
Okay. We can come back to that then at this point. Colin, are you ready for the performance management quarterly report?
I can do that. Yes, ma'am. So the Performance Management Committee has been up to their eyeballs this quarter with the state ESG application and the COC application, which are due. Well, state application was already submitted, and the HUD COC application is in process now. Those are the big things for that committee, is getting scoring groups together, working scorecards, and evaluating projects. So that's what the group has been up to these days. I don't know if anybody else has anything they would like to chime in on for that, but that's the big piece. And if I may, while I have the floor, I want to introduce to the full HSAC, because this might be the first meeting for Ricky Gardner has joined the city of Durham. As you know, Ricky used to be with Housing for New Hope. She has joined the city of Durham and the homeless team as the new senior analyst. So welcome, Ricky, to the team and the full HSAC meeting, and being on this side of the table now instead of the nonprofit side. So we're glad to have Ricky, and look forward to having her as part of the team and part of this continuing her work in our continuum. And sorry, Russ, that she left you all.
Welcome.
We still love you.
Colin, did you conclude your report with
Yes,
that
that
introduction?
was it. There was, and I just a moment of introducing Ricky as switching organizations.
Okay, great. If you have concluded your report, I
have.
believe Ricky is up next on the agenda.
Thank you, Madam Chair. Hello, everyone. It's good to see you all. So I'm just going to give a brief update about where we are with the Continuum of Care competition and our NOFO process. So get excited. Applications are due in Zoom grants this coming Friday, September 27th. Renewal organizations or new organizations that are applying for Continuum of Care funds need to have their eSNAPS applications and all the Zoom grant required documents uploaded in that platform by close of business this Friday. Also, during this time, we are beginning to work on the collaborative application. That is the one that the Durham Continuum of Care puts together, and we talk about our system. So in addition to the project applications from different agencies, the Durham COC has to say, this is what we're doing, and these are what the projects do, and this is how we're performing. So we invite the Continuum to join us for collaborative application sessions. They are on Mondays at 10 a.m. No one came to this past Mondays, and that's okay, because we're going to have a great one next Monday, September 30th, and we'll have another one on October 7th. And Durham did a great job last year on the collaborative app. The highest score was 185, and the Durham COC scored 150 points. So we are looking this year to really maximize those areas where we performed low, and that's where we're going to be focusing our attention during the collaborative application meeting. So there are 4 areas that we're looking at. Colin, can I share my screen?
You should be able to, yes.
Okay. Because if I can't, that's okay.
I think you should be able to share your screen.
Great.
There you go.
Can everyone see this? It says work in Durham increase. Thank you. So we are hoping to be able to demonstrate an increase in rapid rehousing beds. Last year we scored 0 points for that. There is a max of 9, and all HUD is looking to see is, did we serve more households in rapid rehousing? The second area that we're hoping to strengthen our application is our continuum strategy to reduce the length of time homeless. So this is not only looking at our emergency shelters, but it's also looking at the time frame from project entry to housing move-in for our rapid housing and permanent supportive housing programs. We also are going to try to strengthen our strategy to increase exits to permanent housing destinations. So showing that rapid rehousing households still are housed after leaving the project, and permanent supportive housing participants are leading to positive housing destinations. And the last area of growth for us to focus on is a coordination between housing and healthcare. So this would be being able to demonstrate that we have MOUs or MOAs with healthcare providers to provide services to the folks being served by our projects. And this number has to be enumerated. Like, we can't just broadly say XYZ healthcare is going to serve 25 clients. It's going to be XYZ healthcare is going to provide minimally like $25,000 worth of medical care to our participants. So come to the meetings on September 30th. We look forward to seeing you there. And that's all I've got for now.
Okay. Thank you so much for your report. Next on our agenda, we'll hear from Open Table Ministries, Drew Wooten. He'll provide an update on the White Flag plans. Drew?
Good afternoon, everyone. Hey there, sorry about that. Good afternoon, everyone. My name is Drew Wooten. I serve as the Executive Director of Open Table Ministry. This will be our 5th winter doing emergency shelter. It's going to look a little different than it has in years past. So our plan is to start doing White Flag November 1st. We will be hosting a congregate shelter at Yates Baptist Church, which is on Chapel Hill Road, only on cold weather nights. So beginning on Mondays, starting October 28th, there is currently an unsheltered by names list that's on 9:30 Monday mornings. Open Table Ministry will be a part of that call, and we're going to look at the AccuWeather forecast for the week ahead. That's the agreed upon app. So as a reminder, we look at AccuWeather. 32-35 is the parameter we look at. So 32 degrees as a low, 35 with precipitation. So with the shelter that we're standing up on a shoestring budget, we have some dedicated but a small seasonal staff that's working on call and overnight. But we're going to do a 7 p.m. to 7 a.m. shelter, 15 to 20 overflow beds. at Yates Baptist Church, and we'll be calling that on Monday for the week ahead. So for example, on that unsheltered call on Monday, we might look ahead and say, okay, it looks like it's going to be really cold on Thursday, Friday, and Saturday. We'll work with street outreach, we'll work with HART, first responders, other shelter providers, and say, we're going to be standing up our white flag shelter on Thursday, Friday, and Saturday. That gives us time to get our staff, Yates Baptist Church, volunteers, and also to get the word out to our neighbors that there's going to be white flag on those nights. We realize that there's going to be some limitations to that, but we're really excited about the opportunity to partner with Yates and with other providers to ensure that all of our neighbors are kept warm on the coldest nights of the year. And again, we're only going to be offering these on really cold nights when it meets those white flag thresholds. One of the things that we would love to flag is working with the HART team, and would love to get HSAC's thought on that, working with community safety to do some type of partnership specifically around transportation on those white flag nights. I know HART in the past has done some extended hours on really cold nights. I think we're going to have some limitations with the number of folks that we can accept just number wise. And so it'd be great if we know that we don't want to turn away folks at all, but being able to know that if we do have to turn away folks, that there's going to be transportation available, and that we know that they can go to a different provider, and we know that neighbors will go to shelter someplace that would be inside. So I would like to put that on everyone's radar, that perhaps we could partner with the HART team, and they have just the dedication and the bandwidth to provide those resources. Yeah, I think that's about it. Colin, Ricky, am I missing anything? Is there anything else that we'd like to share? I'm excited. We haven't done anything like this in the past. It's been different, but I'm excited.
There is a question in the chat for you, Drew.
Yeah, so, okay. Ryan, so that's a great question. So we'll put out some communication. Like I said, we'll do these Monday meetings. We're going to have a phone line set up so that folks can call a number. There'll be a recorded message because the nights will be changing throughout the week. We'll have a spot on our website. We'll also have some physical signs around town when there is white flag. In terms of other shelter providers, not to put folks on the spot, we will have a communication with the lead agency, other shelter providers, so Families Moving Forward, UMD, Open Table Ministry. I've also had some productive conversations with Durham Rescue Mission. They are also doing a lot of overflow space on really cold nights. They also do not have sobriety requirements. So trying to just get some really clear information and get some better transparency about what they're doing, so that if they're doing it, we can take advantage of it. So hoping to have more of those conversations between now and November 1st, or really between October 28th, so that when we're starting those conversations, we can be very clear about what everyone's capacity is on those white flag nights. So thank you for asking that, Ryan.
Any other questions? Thank you, Drew.
Tracy.
Tracy, please go forward.
Yes, I just wanted to ask a quick question. With transportation, how will you have a service area that you're trying to focus on in terms of targeting those individuals that might need transportation, or is there a time frame that people will be able to access transportation?
Could you say that question one more time, Tracy? I'm sorry, I couldn't quite hear you.
No problem. I said, will there be a target area for providing transportation, or a time frame in which people can access transportation to your organization?
Great question. So the location that our shelter will be located is on 2 bus routes that will have frequent stops on the nights that we'll be hosting the shelter there. Particularly for transportation, we're thinking if we are at capacity and folks need to go to another shelter, we want to make sure that we can provide transportation on site to those other locations. So it'd mostly be from Yates Baptist Church to another location is what we're thinking with transportation.
Okay. All right. Thank you for clarifying.
Mm-hmm.
Any other questions? Thank you, Drew. I'm sorry, Dorothy, you had your hand up? You need to unmute, I think.
Hi, everyone. It's great to see you guys again. I'm going to lower my hand. But this discussion that we had during our last meeting regarding the hindrance that potential tenants face to secure housing, I proposed a bill to our House representatives and Senator. Senator Murdoch reached out to me and said that a bill has been passed in this session to address the homelessness. She said it's kind of similar to what we were requesting about removing the evictions from their records after 3 years, and also sealing the records for cases that do not end up in eviction. So a bill has been passed. I'm trying to share it in the chat. I can send my proposal that I proposed to the House and send it to you guys and see if it's similar to the bill that they recently passed to assist evictions, because I know that was a hindrance for many of the potential tenants. So I can try to email that to the board, or I can actually send their bill with my bill to see if they kind of match or if we need to update it so they can actually pass a bill on that to protect future tenants. Thank you. Thank you, guys.
Thank you, Dorothy. Colin, I believe you're up next. You're going to give us an update on the evaluation.
Sure. Thank you, Madam Chair. I wanted to share with you all the coordinated entry evaluation. And before I get into it, I wanted to sort of set the stage for what this evaluation is looking at. The coordinated entry evaluation is an evaluation that we are required to do each year as part of the state ESG application that is submitted. And this is where we look at the only coordinated entry. So it's Volunteers of America and DSS on Entry Point Durham. And how many people come into Entry Point? How do people move through Entry Point Durham? And then we also have a coordinated entry process for people who are in the homeless system to go from homeless to rapid rehousing, permanent supportive housing, and shelter. So it's sort of looking at that. We are not looking at full system exits. This is not a system performance measure. That is something that we need to look at in a different way, where we would look at a emergency shelter evaluation, a rapid rehousing evaluation, and be able to look at those projects and the inflow, outflow, exits to permanent, length of housing stay. So this is only looking at the coordinated entry, total number of people served at the front door, and then how many people are served at the back end of the homeless system as they move through shelter into permanent housing. Questions so far? Let me pull up my screen here. I'm going to walk through this. So if you can all see this. And I can make it a little bit larger if you'd like. And Madam Chair, I can't see if questions come up, so please interrupt me if questions come up. Happy to take questions as I go.
Will do.
All right, so can everybody see this? So this is, we're looking at our total number of people who are calling and working through Entry Point. So this is where we're starting, and we're looking at total persons served. And in the year ending 2023 compared to the year ending June 30th, 2024. And you can see we increased by a little over 100 people were served through Entry Point, up to 3,491 people called us. That translates into roughly 2,061 households. And household, keep in mind, it can be a single adult or a family with more than one person, if you count heads of households, because every head of household is a household of one or more. So that 3,491 is total people, 2,061 is total number of households. So we saw 61 additional households coming through our system this year. On the good news side, while we saw an increase in people and households, we did see a decrease in the number of veterans. So veterans are doing a great job of moving in the right direction. Chronically homeless persons stayed statistically flat. Keep in mind, number of veterans and number of chronically homeless are by self-report. So this is not, Entry Point is not calling the VA to verify, hey, Johnny said he's a veteran. Do you have Johnny as a veteran in your files? And they may say yes or no. That's not what this is. This is by self-report. So chronically homeless persons is by self-report. And this could be an underrepresentation if we actually went through all the questions and screening tools and verification paperwork. Or it could also be an overrepresentation where people have been homeless for a year or longer, but may not have a disabling condition. When we look at data quality, HUD requires us to report on various types of data that has to be collected for a variety of reasons. This looks at how many errors, what percentage of errors do we have in this? So we're seeing Entry Point's doing a better job of getting personally identifiable information, which is often very hard to do with some folks, especially when you're talking about paranoid schizophrenia or other mental health issues, substance abuse, general mistrust issues of getting that kind of information. So we're moving in the right direction there. Client location used to be a required data element in previous APRs, the annual progress report. This is no longer one of the data points that we're collecting. It gets collected in a different way, but to be able to do apples to apples, this is what we determined was the best way to do it. Disabling condition, we did see a little bit of an uptick in errors on collecting disabling conditions, and we did see better outcomes in where people were exiting to. So we're doing a better job of finding out. Only 41% of people had errors in exit destinations from Entry Point. And some of that is you get an error notice if you don't know where they went. And you can't put something in that box, it gets counted as an error, generally speaking. Now, HUD and the city and the county are always interested in equity. So as we look at equity in terms of racial equity within the system, what we're seeing is we still have a disproportionately high number of people of color overrepresented in the homeless system. As we're aware, the city of Durham and Durham County are roughly 45% of the population identifies as Black or African American. However, in the homeless system, we see 77.5% of the persons experiencing homelessness are identifying as Black or African American. If we were a city and county at full equity, we would expect to see that number in that 40 to 45% range, in line with what the overall population of any racial group of the Black or African American community would be. In the population, you would expect to see a similar population, but we're not seeing that. We're seeing that we're actually growing number of people who are Black or African American experiencing homelessness from last year, moving up about 1%. Meanwhile, we're seeing people identifying as white dropping as an overall percentage in the overall homeless system. These are other categories that we look at as HUD has changed their racial reporting tools, where you can actually you could check off every racial group that applies to you. So there are, groups in there where you have multiple races. Now you could have a multiple race could be, I identify as white and Black and Asian and American Indian and Middle Eastern and Hispanic. That would qualify under your multiple races group. Otherwise, we would have 34 different racial categories here. And to boil it down for easy digesting, this is where we landed. So as you can see, keep in mind this 12% and 77.5%, because these are sort of what we're going to be looking for throughout the system to see if our system is operating at equity with the numbers of people who are calling in looking for help. As people migrate through the system into different programs, we want to see that we're in that 77.5 and 12% range for people identifying as Black or African American and white throughout programs. When we're looking at people identifying as chronically homeless, we are looking at statistically, we're flat. We did have 11 more chronically homeless households showing up in this year's count versus last year's, and our numbers of not chronically homeless remain the same. So percentage wise. Veterans, this is where we're doing really well. We're looking at number of veterans over here where we had 129 veterans calling in. 17 of those were identified as chronically homeless. 112 were not chronically homeless. So this is good that we're moving in the right direction, even in terms of numbers, even though our percentage of not chronically homeless moved up 1.5%, but statistically we're flat. Number of households, we had 17 households that were chronically homeless and 110. Most of these chronically homeless, most of them were single adults. There weren't many there was about 2 that had children that had called through our system. Domestic violence or intimate partner violence. This is the concerning piece. We saw a big jump in people experiencing domestic violence. Went from 305 people reporting domestic violence to jumping up to 376 persons this year. And the more concerning piece is this domestic violence is happening more recently. So 134 people having experienced domestic violence within the last 3 months versus, later on and further out. Not that we want anybody to experience domestic violence. We want to make sure we're responsive to that. And in order to help counter this, we're hoping to reallocate some rapid rehousing money through our continuum of care application and hoping to get some additional domestic violence bonus money if we score high enough in the areas that Ricky talked about earlier. Exit destinations. So this is looking at entry point served, that over 3,000 people. This is where did they exit to from entry point. 4 people returned to homelessness. 720 people exited to permanent housing. 23% moved into permanent housing, which is up from last year, which is fantastic because that's the goal of our system, right? Is to get people into permanent housing. The other piece that Entry Point is responsible for doing is getting people to exit homelessness, which can also be a positive thing if they even get to a temporary destination. So 34.6% of the folks who called were able to get to temporary housing situations. So right there, you're looking at 58% of the people calling were getting into temporary or permanent housing situations, which is a big increase from the year previous, where we were at 49. So kudos to Entry Point for getting folks into temporary and permanent housing and ending that homelessness, at least temporarily, for almost 60% of the people calling. The other destinations is about 40.1%, and 1% we're going to institutional destinations. Institutional can be anything from jails and prison to mental health and substance abuse to hospitals. And other destinations count as didn't share the information or passed away, or some of the other ones. And Nicole Lamb, if you're here, you can jump in and help fill in on that if you want, when you get to that part. Emergency shelter. So this is looking at Entry Point moves people into temporary destinations, which includes emergency shelter. So this is looking at what was the racial composition of people in the emergency shelter system for the year ending. And remember that 12 and 77.6%. Here is where we're seeing 74% and 14% of people who are identifying as Black or African American or African moving into the homeless shelter system, and 14.7% of people identifying as white. So we're a slight overrepresentation of people identifying as white in the emergency shelters, and a slight underrepresentation of people identifying as Black or African American in the emergency shelter system. And we're pretty close to equity. I mean, 77% is where we need to be. We're within, a smidgen of that and a little overrepresented here. Overall, we're doing pretty well on making sure we've got equity within the system.
Colin, there is one question in the chat.
Sure. Where does diversion
Help. Yeah.
Is it diversion? Okay. Where does diversion help for getting out of town funding or people wanting to return home fall? What about diversion funding to prevent an eviction? So that data would fall in this permanent destination or temporary destination, depending on how that diversion was classified. If it was getting out of town, it would have been permanent. And if there was something to prevent an eviction, that we don't really have an eviction diversion necessarily with Entry Point. They do sometimes step in and help prevent somebody, but that would be counted in this 720 people going to permanent destinations.
There was also a mention ahead of that from Dorothy about the budget. Maybe you can address, if it doesn't fit now, you can address it at some point.
Sure. Let me go back and look at it in a minute. Permanent supportive housing, rapid rehousing, new client data. So this is looking at our referrals for people who are experiencing homelessness and looking at rapid rehousing and permanent supportive housing. And this is sort of how do we move folks into permanent housing. These are two tools that we do use to get people into permanent housing. We served a total of 269 persons in rapid rehousing for the year ending 2024, which is about the same as we did the year before. You have to remember, rapid rehousing assistance and people can remain in that project for up to 2 years. So in order to see what did we do in 2024, we have to look at how many people left and stayed from the year ending in 2023, how many carried over into 2024, and how many were new in 2024 to figure out this. So we only had 104 new people coming into rapid rehousing because people carried over. That would be 165 people carried over from 1 year to the next, which gave us room for 104 more people to come in. People are carrying over for a number of reasons, and that number of reasons can be any number of reasons. It could be economics. They don't have enough money to pay the rent and they're still trying to build it up. They could need the ongoing supportive services while they have the money to be able to pay their rents. So that's why we have folks carried over from 1 year to another and then folks exiting. So we should hopefully see an increase in new people in 2025 when we do this report next year, given that 141 persons exited rapid rehousing during the year. When we look at permanent supportive housing, when we run this longitudinal APR, includes not just our COC funded PSH, it also includes VASH, which are the Veterans Assistance permanent housing for veterans with disabling conditions and are chronically homeless. We have right now 443 people were served in those two combined. There were 114 new participants that were picked up in that year. The majority of those were VASH. And I have to go run different reports to pull out how many were VASH and how many were COC. off the top of our head, it's maybe a dozen COC members were VASH, COC, were COC PSH. Rapid rehousing, race and ethnicity data. This is looking at our racial composition of people entering rapid rehousing. Remember that 77.5 and 12. Here we are really working at equity in terms of people exiting to rapid rehousing in terms of racial composition. So we're really at equity, and if anything, underrepresented by people who are identifying as white in this program. So we're doing well as a system. We're on a track. We're not perfect in everything, but when you look at it across the spectrum, we're moving in the right direction for an equitable system to better meet the needs from a racial and ethnic standpoint. Once again, we're maybe a little overrepresented in permanent supportive housing by people who identify as white, and at just about that 77.5%, a little underrepresented in the Black or African American community in this permanent supportive housing program. We have talked about this to some degree, as permanent supportive housing does require diagnosis and documentation of disabling conditions and disclosure of those disabling conditions. That has been something that we have seen has historically been overrepresented by people who identify as white and underrepresented by people who identify as Black, African American, or African in just cultural working with doctors, trust of the medical system for very good historical reasons, and just willingness to share that type of information publicly. So we are working with providers to try and help normalize, so we can try and help more people feel more comfortable and confident to get the help and care they need, and to be able to exit homelessness into programs that might be assisted. So this is something that we've been working and very intentionally at, and we are doing a very, very good job. There are some jurisdictions where these are completely inverted, where it's absolutely backwards. So kudos to Durham and the team for being able to do that. So this is kind of how we shake out, and from a racial ethnic equity standpoint, we do a very good job of keeping the sound of the system really well balanced, and kudos to the coordinated entry staff at the at Entry Point and DSS, and to Jeff being the coordinated entry administrator as we're working through getting rid of the VI SPDAT and using tools that are more less racially biased. All right, so let me go back to questions in the chat. Not familiar with how the state budget is done with my minimum housing process due to the crucial housing trust Durham is facing. Dorothy, are you asking if we as an HSAC can put a budget request in to the state or to the city or county for funding for housing?
I'm not, I think my concern is, from my minimum knowledge, is that I'm not sure if it's January, correct me if I'm wrong. Every January or sometime around that time, we have to provide a proposal. Correct me if I'm wrong, I don't know the procedure, but we have to provide a proposal of the state needs and what we need and why we need it. And I think it goes to DC. I know I'm originally not from here, but my state, we have to speak of the needs of the citizens and why it's so crucial more than any other needs and why we need more money. So once we submit that to the powers that be, then they issue they provide that budget. I don't know how it really works, but this is what where I grew up at, that was what I was told with politicians, that they get a budget of the people needs. And if the need is, our need at that time was homelessness.
Mhm.
And that was front and center before education, before everything, because many understand that you can't address education and other issues if there's no shelter, no stable shelter. So because that was our crucial need, that was first amongst anything, you know, activities or anything that we had on the budget, the housing was first, number one. And that was our largest budget because we thought that it was important to address that issue, you know, because I can only imagine not having housing, how, you know, horrific that would be, you know. As I told Senator Murdoch and a couple other senators and House representatives that, you know, people live their lives in their house. You know, their privacy is there, and to be thrown out on the street it's just horrific. And they agreed. They said we all need housing, you know, we all need housing, and that's the important need of the people. So can we put that front and center before anything that goes in the budget? I mean,
So there's two pieces there where we've got one, through our HUD COC application, we prioritize that. We try and go after additional money. Then the last several years, the Homeless Services Advisory Committee has sent requests to city and county during the during participatory budgeting, and requested money for additional housing resources to come online for flexible housing vouchers, expansion of emergency shelter, and additional supportive services to try and help move the needle a little bit. So we do that, and it's getting about that time again this year to go through that process in the October, November timeframe to start advocating for that. So that's going to be something that the HSAC can do at a local level, is reaching out to the local elected officials to try and have additional money resourced for this. And that's something that HSAC members can do. As a city employee, there's only so much I can do. I can't really do too much on that. I can help and facilitate letters on behalf of the HSAC and encourage the HSAC to work towards helping to advocate for resources whenever it's legal, ethical, and morally able to do so. So I don't want anybody getting in trouble for violating any rules of federal or state or local. So please be aware of those limitations on lobbying.
Great. Thank you, Cullen, for
Mhm.
your contribution. And I can say it from all of us. We truly appreciate your dedication and work towards this
Mhm.
common issue, but, you know, severely. We thank you. Thank you so
Mhm.
much.
You got it. Ryan, questions there. Do we know how many exit into temporary destinations re-enter into homelessness? That would come from, I don't, we might be able to run a report for that. I would have to, but we wouldn't necessarily be able to pull it from temporary destinations. It would be all exits from a particular project. And as a system, fewer than 10% return to homelessness as our entire system into homelessness after going to permanent housing. And we haven't been running it for temporary, but all exits to permanent housing is what we're looking at in that report. We might be able to pull a report to temporary housing, but that's something I'd have to look into. Is it possible to break down other destinations? I would have to look and see what falls into that. There might be some additional detail in the APR that could break that out. If not, I would have to do some digging and see if we can do that. I just don't remember. I might have boiled four subcategories into other destinations. I can look at that in a moment, unless Jeff or Ricky happen to have an APR open and can look at it real quick. Otherwise, I'll look at it in a moment.
You know I do.
All right. Thank you, Ricky. If you can pull up an APR and look at other destinations and see if we've got, if we can break it down, then I can pull the report that I have and share that either later today or in another report. Do we know how many people contact Entry Point but maybe exited because they were unable to make contact or stay in contact with them? And since we might be given a phone number, that would be the number of, that might be the unknown destinations. Some of those might be because we couldn't get back in touch with them, but a lot end up sort of coming back in there and looking at. There may be a little bit of duplication in that. No, there isn't duplication in that 3,000, sorry. So I don't have a way in our current data to track. Trying to think. I'd have to look. Let me look and see if I can pull out data on how many we lost contact with. We're doing better with veterans because there's more resources specifically dedicated to veterans. Veterans have a lot of VASH vouchers, and there's an SSVF program that specifically does supportive services for veterans, and the veterans have a little bit more resources as a percentage of overall. And stayers and leavers, that is numbers of people who stayed in the program from one year to the next. And the number of leavers means this is how many people left during that program year. Does the 2024 program include any families or individuals who are also included in the 2023 data? There would be, yes, there would be some overlap in that. The only place that it got deduplicated would have been in the rapid rehousing and PSH with new entries. In terms of entry point data, to deduplicate, that would be a manual deduplication process between the two, unless I ran a combined APR, which wouldn't give us year to year, it would just give us total number. So I did not deduplicate in that 3,000, that number of 3,000 people, and didn't have time to export it all to an Excel to do that. Chelsea Cook, do we have data on people exiting rapid rehousing? How many are timing out? That is a different report. That's sort of what we were talking about at the beginning of the meeting, of wanting to look at a rapid rehousing report, a PSH report, an emergency shelter report, where we would look at exits to permanent housing, length of time in program. And that would be our next step. And we need to work with our providers to make sure that they understand that when we put the report together, it's not going to be looking at rapid rehousing as a group. It's rapid rehousing as a continuum. And then it would be Housing for New Hope, Rapid Rehousing Project 1, Housing for New Hope, Rapid Rehousing 2, Urban Ministries Rapid Rehousing, FMF Rapid Rehousing. So you'd be able to see, here's what the average is, and here's how each program is doing on each of those matrices. So we can look at how well are we performing and where can we learn. We have not done that yet because we want to make sure that we're working with our providers before we start publicly sharing that kind of data on that micro level. And then we would also do it for the homeless shelter. We'd also do it for emergency shelter, rapid rehousing, and PSH on the outcomes there. And then sign-in link, I don't have the sign-in link yet. I've been tracking the attendance based on the participants and the participant list. So we're good on that. And we'll print out the participant list that's over here to make sure it's recorded. So we'll get you covered. Thank you, Ms. Holmes. I knew you had to be here somewhere, but you must have been hiding under another name. So I'm glad I know we got Ms. Holmes here. Woohoo! Thank you. All right, any
Yeah.
other questions?
There is one other.
Any way to check for people who were in rapid rehousing? That would be in our return to services, or we would have to, that would be a pretty big manual list. We'd have to run a report, then find every HMIS number who exited rapid rehousing or PSH, then take all 3,000 of the people who called entry point and manually match through that 3,000, looking for looking for matches. I don't know that there's a quick, easy way to do it. There might be, but we'd have to talk to NCCH to see if there's a custom report that can do that. Go ahead, Ricky.
Thanks, Colin. Yeah, there's not an automated way for us to do it, just putting that out there. Maybe something NCCDH could do, but also just looking at, I think, a client's profile information, you would be able to see it that way, but I think it would have to come from the data center.
Okay. Any other questions? Thank you, Colin, for a great report. Will we get a copy of this sent out to us?
We sent it out last week, I think, and asked for questions to come in. But we can send it out again.
Okay. Is there a particular place where all of these are posted? I believe that was mentioned
We
previously.
will get them posted on the COC website, which is within the Community Development Department. And is Nicole Lamb here? I know Angela's on with Nicole. And I think
I'm
Nicole
here.
wanted to, thank you, Nicole. I know Nicole wanted to give like a brief update on Entry Point. So if you don't mind, madam, do we have a minute for her to get through her slides to give an update on Entry Point, some challenges and successes of what's happening from the ground floor?
I believe we have a few minutes, yes.
Perfect. Thank you.
Thank you, Madam Chair. I'll share my screen with my slides. Hold on. Here. Okay, can everyone see the slides? Okay. So I just wanted to talk about coordinate entry. So we are, our program, like Colin stated, it is with VOA and the Department of Social Services. And we have had coordinate entry the contract for the last 5 years. This is our 5th year. And we serve as an entry point for individuals and families experiencing homelessness to access services in Durham, North Carolina. And it's funded by the city of Durham. Our goal is to divert as many clients as possible from entering the homeless system by directing them to the support and resources other providers, rep-free housing, permanent supportive housing. So as of right now, we have 2,800 individuals diverted from homelessness, and 1,516 of those were diverted to permanent housing in the whole program. In the last 3 years, because we had a 2-year contract with a year extension this year, our funding was $414,000. And each year, what I did was I just kind of separated so we could see how many households we diverted and then how many were towards permanent housing. So just so I can explain, the 1,112 households we diverted, some of them were travel and they went to family. So we put that as temporary diversion because we don't know if they'll come back to Durham, because the family says or friend says, yeah, they can stay here until they get on their feet. But that's not, I can't say permanent, because if they decide to say after 3-4 months, no, you can't stay here anymore, and they want to go back to Durham, they're going to come back into the system. So with the permanent housing, how we do it is those are the ones that have had the one-time assistance with our funding, and the one-time assistance, or we've helped them, move in with just a security deposit. So we do know they are in permanent housing. This year, why the numbers are a little bit lower is not the end of the year, fiscal year yet. But also what's happening is we're down to 5,000 of our funding left, which will not, we will not get more funding until end of June. So July 1st of 2025. So, so we have reached out, and here's the barriers. What we're seeing is the cost of security deposits have increased, the rents increased, with the fair market rates, the increased request for security deposit, would just, and I understand with the permanent supportive housing programs because they need help with the security deposits, what we're fine with. And then the arrears for families to move into rapid housing programs. And then transportation cost has gone up, for each, even, one person. It has now gone up, and we do try to use like bus tickets, train tickets, gas cards, but all, the money has definitely increased and just the capacity. And with our one-time rapid rehousing assistance, these are for unsheltered clients. And we do send the referrals, which we are so happy to be able to send to our providers, into the COC providers to help us with the one-time assistance, with rapid rehousing for our clients. So far since August, we have sent over 20 households over to one-time assistance. And then with DSS opening doors, we have sent over 25. And these, with DSS, how theirs is it's only apartments in Durham County. So they won't do rooms to rent, you know. So, and with rapid housing, they will, as long as there's a year lease. And then with DSS, the max they can do is $700 per household. So, if you think about the barriers, security deposits are usually, first month's rent and then the first month. So usually if you think about like a room to rent is $650 to $700. So you're looking at total $1,400. So $700 for security deposit and $700 for the first month's rent. So with this max of $700, then sometimes what happens if the client, does not have the other amount, then they lose their opportunity of the approval to move in. So I just wanted to let HSAC know just the barriers that we're running into. We have put out, a VOA has put out Adopt a Family donation, what we're trying to do, of just saying, even $500 head of household, just per household, so we can maybe try to help with security deposits or anything just to help our clients, just so they can get out of the unshelteredness and just being at risk, of being unsheltered. Does anyone have any questions? I'll stop sharing.
Any questions? Thank you, Nicole.
Thank you.
I believe we've moved through our agenda. Should we go back and look at the minutes? Or are we going to table that?
It is up to you, Madam Chair. We can, if people have read them or want to read them, we can do that, or we can put them on the agenda for next month and approve September and August and October. And I see a
Have a
hand from Tracy.
Tracy, yes.
Yes, I want to thank her for giving that report regarding the DSS program. That's pretty similar to what we're seeing in our ILI program, which is Independent Living Initiative, to assist individuals with security deposits, eviction prevention, and utility assistance, whether there's a disconnection or startup. Many of our individuals, they're from Durham County, are eligible for assistance. However, the caveat is that they must be willing to be engaged in some level of lower level services, which sometimes that's supportive in terms of their overall mental and behavioral health and the stress in terms of cost of living, parenting, job loss, all those things, and which can help individuals long-term in terms of assisting, their families and themselves. We're running into a lot of individuals who, for whatever reason in Durham County, have just, the barriers are tremendous. For example, we had one young lady who has, and I don't know how she qualified for her rent because her income could not have sustained her lease over time. So I don't know if it was, for lack of a better word, a kind of a, we do have different tiers of housing across our country. And there are some landlords who really do take advantage of individuals who are 30% below the AMI. And so her rent exceeded her income. And I don't know how she qualified for this, but she was facing eviction and she had a prior eviction from the Durham Housing Authority. So it's individuals like that who have very complex needs across our communities, dealing with housing and getting them into housing and sustaining their housing. We do still have funding available in Durham County. However, they must be connected to us in some way. There is a 1-800 number to our access center that's available 24 hours a day, 7 days a week, 365 days of the year for individuals to be able to connect with us. But again, they've got to be willing to kind of work with us, share information. As with any organization, you're trying to gather how much they owe and have supporting documentation in order to pay the vendor to assist them in their housing. So just want to let the community know, as well as this committee know, that about the program. Many of you are partners with us in the work in which we do, but it's not easy every day when we're kind of working with people and trying to assist them with their housing sustainability. So just wanted to echo some of the same things in which was shared earlier. Thank you.
Thank you, Tracy. I believe Shanta, you were next, and then Tarita.
Good afternoon, everybody. I'm not sure if this was on the agenda, but I just wanted to kind of give a brief update about the upcoming point in time count. We have not set a date for that just yet, but it is the last 10 days of January. That is the requirement by HUD. I did want to put out there that on October 7th at 2 p.m. and October 9th at 11 a.m., we are going to have some ideation sessions. We want to ensure that we are inclusive of everybody's thoughts, ideas, and feedback from previous PIT counts this year, so that we can have those, ideas in time to, an adequate amount of time to actually implement those ideas. We know that the community offers great feedback. You all have great ideas, and we want to make sure that, your great ideas are not heard in December when point in time is in January, but early enough on so that we can actually implement and follow through with those ideas. We have set up a Zoom meeting for that, and I can send that out to someone. You can all let me know who to send that meeting link out to. And you can also send it out to the full HSAC from there. If you're interested in attending those ideation meetings, it is likely that we will be setting up committees so that we can do focus groups for like the youth point in time count, people in cars or families, and just the general unsheltered count. So we want to just make sure, like I said, that we're inclusive, that we're being thoughtful and mindful of all the feedback that has been given in previous years, and to prepare for this year. We have not started planning, but before we start planning, we want to make sure that we get that feedback and those great ideas from you all at onset so that they can be implemented adequately.
Thank you, Shanta. Sharita, I believe you had your hand up.
Good afternoon, everyone. Thank you, Madam Chair. I put one question in the chat, and that question was, I have two questions. So my first question is directed towards Nicole Lamb as it relates to entry point, and then to the greater HSAC. Is there something that HSAC can do to make an ask or request for some additional financial assistance for entry point to be able to help folks? Coordinated entry is our only kind of real diversion point that we have to hopefully prevent some people from entering our system. So, that one question is there an ask of somebody that we can make as HSAC, because we do need funds for them to be able to continue to help us combat people entering the homeless system. And then my second question is for Tracy. Tracy was talking about ILI funds and talking about access to ILI funds. And so I have a question, Tracy, as it relates to that. Who can request ILI funds? Because if our clients only have like medication management? Are there psychiatrists making ILI requests? Is this something that the care managers for folks who have the Alliance tailored plans? Will those care managers be able to make those ILI requests? Just trying to figure out how people would access that if they were getting the minimum level of services through Alliance.
Sure, good question. They would start through our access center. They would definitely be connected to care management. If they don't have a provider, the providers are, our service providers. We don't provide direct delivery of services or care, but we do work through a network. But if individuals are not connected to services, our care management staff will be able to help be the liaison to connect them, do the assessment, and assist them with applying for ILI funds. First and foremost, individuals who are submitting an application must be connected to us in some way, and the providers and internal staff must undergo training before they have access to our systems to submit an application. And so there are a few steps. It's not a hard process. We make exceptions every day for individuals who are dealing with difficult and extenuating circumstances. However, they also must be willing to disclose information and documentation, because we cannot pay someone without having the accurate amount to pay someone. And so that's a part of this process in order to submit supporting documentation for the financial need that we could assist them with. Hopefully that answers your question.
Thanks, Tracy. I was just curious. I know that I have been through the ILI training, but it's been a lot of years since I actually filed that process for someone. So I probably need a refresher myself if that is still an option for me in the community to help people get access to those ILI funds. But just curious about the care manager's role now, because a lot of the clients who are getting assigned to the tailored plans are unbeknownst to them auto assigned to a care manager, and just trying to figure out how they would navigate that system if they needed ILI. Thanks.
Okay. And also we do hire, we have on staff peer support specialists who kind of help people walk through the system of care and provide resources for them every day in terms of being able to assist them, because we know sometimes it can be difficult to navigate not only the system of care, but the housing system, the financial system, being able to have a banking access to receive funds and assist people with things like that sort. So, I mean, if you have any other questions, I'd be glad to talk with you offline as it relates to the program and the application process.
Thank you, Tracy and Sharita.
I have a question, please.
I believe Dorothy had her hand up. Dorothy, did you have a question? If we could just one.
Sure. You can go ahead of me if she wants.
Okay.
Thank you, guys.
This was Angela Holmes. I just wanted to say that I've had the training as well recently, but I was told that I could not do the ILI through Entry Point. Is that still correct?
You're trying to submit an application through Entry Point, from DSS?
Well, I took the training, but I was told that I could not do it through Entry Point. Is that still correct?
Yes, you have to be either on the care management side internally or part of our provider network.
Okay, thank you.
You're welcome.
Okay. Are there any further questions on that issue? Comments?
Yes, I'm sorry. Thank you so much. Chair, Ms. Renee, thank you so much for your assistance. I wanted to talk about what Ms. Stone and Ms. Lab addressed about the barriers they face. I had a question about some of the requirements in my own personal experience. Some of it doesn't seem very logical or reasonable. Is there a possibility we can speak to someone? For example, one of the clients that I assisted for housing, they were saying to her that she needed to like get a referral from her job or some things that didn't seem reasonable. And the argument was the qualification was that she was low income. She met the income requirement. So we were like, this doesn't seem realistic that she would need a referral from her job to get a financial assistance. We already gave the pay stubs. We already gave all that she needed. So the barrier was they needed a letter to say, was she a good tenant or something like that. So a lot of barriers, you know, Miss Nicole and Miss Lap mentioned, they seem a little bit unreasonable and illogical. So is there a possibility is there an appeal process they could file to say, hey, this person meets the income requirement, which suggests that that person is poor. They seem like they meet the main essential requirement, which is being poor. All these other barriers or requirements that you're requiring doesn't seem reasonable. Is there an appeal process, or, you know, like, how can I put it? I remember when Medicaid was denying people a while back before the bill was passed. And they started to expand it because they realized a lot of it was unrealistic, or it was barriers that didn't really make any sense. So is there a way we could file an appeal to say, hey, this is a barrier and it's not a logical barrier? It seems unreasonable. Thank you, ladies. Thank you all for allowing me to share.
Thank you, Dorothy. I appreciate it. I know with coordinated entry, with our city funds, we do have requirement of documents that we need to be able to assist with the financial assistance. And when we do get it audited, we have to show. Like, there's one that's a one-time assistance agreement that needs to be signed by the landlord, the client, and then us, just stating they understand it's a one-time assistance only, and that the client would be responsible moving forward to sustain, you know, the rent. And then the other form, you know, we do need, which is from the landlord, it's just the W-9, because that's how we get the address and the name of the landlord of the company, so we can send the check to them, because we send it directly to the landlord, so the client's not involved in the middle.
Okay. All right. Thank you for those questions or comments. If there are no other questions, I believe we've moved through the agenda. It seems the consensus was that we would table.
I'm sorry. I had two questions, Madam Chair. My first question
Okay.
was about more funds for Entry Point, and I just don't want that to get lost. I
So
really want us to have some conversation about it, because we need funding for Entry Point.
I can answer that question.
Please, Colin.
Yes, HSAC can request money for anything HSAC would like to request money for from the city, the county. We just have to, as an HSAC, determine how much money, what programs are we asking for money, and then prioritize. Because earlier today, we were talking about we need more money for White Flag. We need more money for emergency shelter expansion. We need more money for permanent supportive housing. We need more money for supportive services. We now need more money for coordinated entry. So we have to figure out what the priorities are. And if we don't have money for all of these things, where do we want to pull funding out of? If no money's available, we can pull money out of things that we're currently funding to free up some money. The coordinated entry contract has been I think it's $477,000 a year. That's the total contract value. Does it need to go up? Probably. How much does it need to go up? I don't have an answer for that. Where does the money come from for that? I don't know yet. We do have to put out an RFP for coordinated entry in, sometime in the next few months, because the current contract ends June 30th, 2025, and we'll need a new procurement process for that. There's also RFPs that have to be put for unsheltered coordinating entry. So, is there a need for more money in that? We have to look at all these different projects that we have currently going and determine, do we need all of them? Do we need the same amount of money? Do we need more money in all of them? And if we have projects that aren't needed, then we can say, okay, we don't need this, and let's see if the money can be reallocated. But that's something that we can talk about in a policy and planning meeting and bring some recommendations to the HSAC on.
Okay, sounds good. Hot topic and the hands are still going up. Ricky, I think you were next and then Tracy.
Thank you, Madam Chair. Yeah, Colin, I was thinking, this sounds like a policy and planning, not an HSAC issue. If the policy and planning can put forth a list of priorities and then a letter could be drafted to request more funds, I think that's probably the way to go because the budget's already set.
Thank you. Tracy, you had your hand up.
I was gonna reiterate what Ricky was asking and saying in terms of the budget, we're in fiscal year 24-25. Is this an ask that is presented through council, or is this a request that goes through the Department of the city's Department of Community Development? Just don't know, because at this point it seems like there's several pots of funds that are needed for additional assistance. So I didn't know where that process kind of flows from the request. I don't know if that's a Colin question or not.
It could go both. I mean, community development has a small budget. Most of the money that's allocated for the homeless system within community development is already earmarked for the next few years because of projects that we've already have funded and have decided that, we're currently funding a landlord engagement project. We're currently funding Unsheltered Coordinating Agency that does street outreach, currently using funds for Coordinated Entry with Diversion, currently funding White Flag, currently funding HMIS lead agency, and currently funding out of dedicated housing funds, rapid rehousing as a match for our ESG. So that's pretty much where all our dedicated housing funds are tied up in those projects. If there's extra money available, that's something that we'd have to work out at the department level. Just keeping those projects flat is, hopefully we can find additional money to move up on that. But this is a piece where if we want to do more than what's in the community development budget, that's a piece where there would need to be additional funds coming from other resources, either private and or public, and then allocated and be part of that procurement process to be added to those RFPs so that we could put that out there. If no money were available, we could look at, all right, are any of these projects things that policy and planning thinks are no longer needed, and we can get rid of them and reallocate money, but not sure we're at that point at this point.
Okay, I understand that part. Is the funding from the bond strictly for brick and mortar, or are those funds already earmarked for other projects in the future coming up?
There is money in the housing bond that allowed the homeless team to do some of the things that we're currently doing. So there isn't necessarily more money in the bond for more ongoing things. The bond money was one-time infusion of cash over a period of time. When you put money into the homeless system, those are things that typically are ongoing year after year after year. So if you put money into the homeless system for entry point and more money for diversion, then we're probably going to need more money for entry point and diversion over time. It's not like that gets cheaper. Rapid rehousing doesn't get cheaper over time or stop. So whatever we put in tends to need to go for a longer period of time. As you recall, we had those ESG COVID funds. They came in for a very short period of time. The city and county put up local money to continue a smaller version of that for an additional year. And then that's kind of used up at this point, and we're back to kind of where we are level setting, because that was using some fund balance that was available for one-time short-term interventions or projects, I mean.
Okay, all right, thank you.
Russ, I believe your hand was up.
Sure. I mean, I don't know if this is a comment or a question, but I think Colin makes a good point that, when we have our conversations, we often kind of, Russ's phrase, jump from thing to thing that is the most urgent based on what's just been presented. And we've had that for a number of years. I do agree with Ricky that maybe policy and planning needs to take a look at the prioritization, but I also just it would be helpful at some point. I don't know if there's an executive committee thing. But you know, the interlocal agreement that the city and county approved expects that we will have a strategic plan. We are in the 8th year of operating without a strategic plan. And I think that when we run into these moments, it really highlights the fact that we don't necessarily have agreement on where we're trying to focus, because we know we cannot do everything. And so it creates these moments of, let's work on this, let's work on this, let's work on this. Or if new pots of money come, you know, we can't run off to another potential project. So just asking whether that's executive committee or another group for us to begin thinking about when we can get started on a strategic plan. I know a number of elected officials have mentioned that you know, is a question. I wouldn't use the word concern, but a question about when we'll have more of a plan in place for what we're trying to do to help guide this overall. Hopefully that made sense.
Thank you. Good point. We have a lot to look at, assessing the need and strategizing, having a full-form plan in place is important, as well as being able to understand the budgeting aspects for all of the various things that we do. So we're hopeful of being able to do that. Colin, maybe your team can help us to get there. So that we can pull all of these threads together. I know that we have a certain amount of time for this meeting, and we are beginning to run over that time. We have had a valuable discussion, received a lot of information today. It seems consensus, we determined that we need to delay the minutes until the next meeting. And I believe we're at the end of our agenda. Are there any announcements that are pressing? We have a list of our next month announcements at the bottom of the agenda.
Madam
And-
Chair,
Yes.
this is Helen
Mhm.
Tripp. Just a point of order. We have a motion that was made in the chat. We probably should address that before we adjourn.
Okay, the motion was to,
By Charita
Uh,
McCullers.
let's see. I move that we ask for more funds for coordinated entry. Is that the one you're,
Yes.
Here.
okay? We have a motion on the floor.
I believe
Is there
the for procedure would be to get a second and then a
Second,
discussion,
yeah.
and then if we can't,
I was waiting to see
Yeah.
if there would be a second.
I'll be glad to second it. Helen Tripp.
Okay. It's been properly moved and seconded that we ask for more funds for coordinated entry, moved by Sharita McCollier, seconded by Helen Tripp.
Question, is this an
Question?
absence is this an absence of setting a priority?
Yes, it is.
So just declaring coordinated entry more important than all the other things?
No, I'm not saying the coordinated entry is more important than all the other things. But what I am saying is that we need to control how many more people are entering the system. And so our diversion plays a role in trying to at least keeping more people from coming in. I get it. I know we have a lot of priorities. Homelessness is a big thing. I think, you know, there's a lot of things that we haven't moved on, probably because of lack of a strategic plan. And there are a lot of asks that we need to make. But nonetheless, the number continues to grow. Every policy and planning meeting, the numbers grow. And what I've noticed over time is that we've become desensitized to that number growing. I feel a whole lot of anxiety every time I see that number grows, but I think some people have just been able to swallow it and it's been okay. And that's not okay. And so, while I do know that there are tons of priorities, I know that I don't want this number to continue to swell. So what can we do to stop the bleeding? Because we already know that we have a problem on the other end. There's a lot of stuff going on in our community that I think that HSAC is not privy to. There's a lot of things that I know about things that are going on in our community that HSAC is not privy to. We could have the potential of more people on the street. I as a real reality. We need to figure out what we're gonna do to stop the bleeding. That's all I want to say.
Point well taken. I believe there is a point of discussion on, it's a very broad motion that we have on the floor. And so there may be more definition needed, but we do have a motion that has been properly moved and seconded. Any further discussion, or are we ready to move to the question? Hearing no further discussion, are we ready to vote? All in favor of the motion as stated, please vote by, I guess we should enter it into the chat. Is that correct, Colin? All in favor,
Yes,
if you
ma'am.
would enter yes or no in the chat. Trying to follow this as well. It appears, is anyone?
Madam Chair, I think the noes have it. I just want to make sure that my point was brought to the table. Thank you very much.
We appreciate it, and you are correct. The motion has failed. But it is, we feel your pain, and we are in accord with your pain. And hopefully we'll be able to address this in a more systematic way going forward. Okay. I believe we talked about the announcements. There are no further announcements. Are we ready for a motion to adjourn?
Madam Chair, this is Russ Pierce. If I could just add one brief piece on the strategic plan thing. And I understand what Shrita is saying, that she feels like some people are getting desensitized around this. I don't think that many of us are desensitized. I think we are weary of bouncing around, and that we want to really have a plan for what we're doing. So to that end, many of you know that many years ago, $10,000 was left over from the 10-year plan to end homelessness. It was held at the Triangle Community Foundation. Then we were asked to hold that money, H&H was, for future planning or whatever needs. I would love to see that money used. Our auditors hate that it continues to sit on our books, and we've offered that several times to our community development. But there is $10,000 that could kickstart a strategic planning process. So I'm just putting that out there again for the executive committee to have conversation about how we might move that forward. Because I believe this is a passionate group. I think we're just at the point where we really must have a plan. Else we will grow completely weary jumping around, trying to address all the needs. So just
Thank you
put
for
that
your
out there for
comment.
executive committee to be aware of. And I'll make a motion to adjourn.
Thank you.
I'll
We
second.
appreciate it.
Angela
Okay.
Holmes.
Okay, thank you. It's been moved and seconded. We are adjourned.